Welcome back to Africa. 54 U.S. President Barack Obama is marking World AIDS Day by pledging more cash to HIV research and prevention. President Barack Obama has announced a new initiative to increase research into a cure for HIV. President Obama says his administration will redirect $100 million to the National Institutes of Health to develop a new generation of therapies to fight HIV and AIDS. Mr. Obama also announced successes in several recent policies.
Last month, I signed the HIV Organ Policy Equity Act to finally allow research into organ donations between people with HIV, a step achieved with bipartisan support. And thanks to the Affordable Care Act, millions of insured Americans will be able to get tested free of charge.
U.S. Secretary of State John Kerry said the world is turning a very important corner in the fight against AIDS, but he said the fight is not yet won.
There is major challenge ahead, and it will require major continued commitment in order to complete the task and live up to the memory that we want to honor of all those for whom it was too late.
Well, now for more insight into the health challenges facing African nations, I'm joined by Dr. Agnes Binagwaho, Rwanda's Minister of Health. Dr. Binagwaho is also a pediatrician. And so welcome to Africa 54, Doctor.
Thank you for having me.
Your name is such a tongue twister.
You can call me Dr. Agnes.
Dr. Agnes. Anyway, you see, for the last 10 years, there have been some interesting reports that deaths from HIV, TB, and even malaria have dropped by about 80% in Rwanda. And this is just at a cost of about $55 per person per year. How have you achieved this?
We have achieved that by implementing some principles that are what guide us, what guide the ruling party in implement all social welfare program in the country. Meaning, leave nobody out of benefit, provide equitable access based on geographic, on finance, on gender, on age. When you do that, with a focus on the poor, the most vulnerable, you drain in benefit all the rest of the country. We always tackle the most vulnerable. When you reach those people, all the other one on the line who need the services get them. And
as a doctor, as a pediatrician yourself, I'm sure children are really dear to you. And I noticed that actually maternal mortality dropped by about 60%. Now, this is a country that came out of genocide not a long time ago. How did you manage this when the systems had broken down, especially dealing with babies and mothers?
So we managed it with, first of all, having a vision. We had our Vision 2020 that we create in a participatory process, asking the view of the people that have to benefit at community level up to the top leadership. When we had that vision, we designed a plan around this vision where we want to be in the year 2020. And Rwandan people have a huge ambition of their own life. When we had that and the plan, with the support of our partners, we implement making all stakeholders part of the implementation, making everybody part of the policy design, strategy design, monitoring and evaluation of implementation, and give ownership to communities and local leaders. This is the solution.
Now, definitely, things haven't always just been smooth and easy. You've had to also implement things that are perhaps not necessarily very common to people there, like you've had male circumcision implemented, yes. That kind of a program. How has that been challenging to society?
You know, when you take time to explain to the beneficiary of a program what benefit he will get, evidence-based, they always take it. I don't know one body on earth who just say, this is good for you, it works like this, it starts like that, this will be the outcome, this can be the side effect, this is how you will heal, etc. That they'll say, I don't want it. Nobody is crazy enough. So what we did, we explained the right to information. We explained deeply what we were doing, how to do that. And we take our community members as the experts of an agency of their own life and their own health. And they tell us how to do. We want to achieve this. This is how you have to deal with us. And we adapt our experience, our expertise to the way we can provide services to the community.
Yes. Just tell me a little bit, what is the challenge of particularly treating children, whether HIV or those ones who have TB, as compared to treating adults with the same diseases?
So the challenge to treat children is, first of all, we have to convince 3 persons to reach 1. We have to convince the child, the mom, and the dad. So we have to adapt our explanation at 2 levels. The child, him or herself, and the 2 parents. But if we take time to do so, it's always paying off. We have started in 1 year the vaccination for HPV, school-based, what was never been done national-wide elsewhere. We got more than 93% of adherence, voluntary adherence, because we explained to the parents, we explained to the children, we explained to the teachers, we did national campaign in a country where cervical cancer was even not known as a cervical cancer. We explained to the parents that a girl has an uterus, a cervix, and one of the more killing cancer of a woman is breast cancer, and this cancer, cervical cancer. When the parents have got the message, they all sign off for that. And the children themselves, because they have 11, have to also accept it. They all accept it.
Great. Well, we do appreciate it. I wish we had more time, but we thank you very much, Dr. Agnes Binagwaho, for joining us today here. Dr. Agnes Binagwaho is Rwanda's Minister of Health. Thank you very much for joining us. Well, that's our Africa Health Network report for today. For more health news and developments, be sure to visit our website, africahealthnetwork.com.